012206842. And back to the questions, Doctor. You spoke about several different antibiotics that can be used. Now, does this mean that the pneumonia can be studied and the causative agent, so to speak, the thing causing it, can be isolated and identified enough so that you know the exact medication to use?
Correct. So, in an ideal situation, the phlegm that the person bringing out, what we call sputum, that's phlegm, sputum. That is sent to the lab.
Okay.
The laboratory is able to culture or grow the bacteria, identify the particular bacteria, and then test the bacteria against a set of antibiotics, and sends a report back to the doctor that this is the name of the bacteria isolated and this is the antibiotic best suited for it. But this thing I described to you may take 3, 4, 5 days.
And that's a lot of time wasted.
And doctors usually don't wait. So what happens is that as soon as the patient comes into the hospital, the doctor starts antibiotics based on his experience and expertise. And then he will now send the phlegm to the lab.
Before administering the antibiotic?
Yes. I mean, this doesn't take 1 hour. You collect the phlegm and then start your antibiotics. This is less than 1 hour. Okay. So that by the time the result comes back, 24, 48 hours, 2 days, 3 days, 4 days, the patient would have been on treatment. And then if you need to adjust, then you do. If you don't need to, you continue. The lab may report that the antibiotic you are using is correct, that you should continue. The patient is getting better, you continue. But if the lab result comes, the patient is not getting better, and you now know from the lab report that the antibiotics you are using is not the best for that particular bacteria, you now change it.
Now, does the patient usually get better? This method we're talking about, is it very effective?
No. Pneumonia is eminently treatable.
Okay.
Eminently treatable. Those who die from pneumonia either did not go to hospital at all or came to hospital very, very late.
But you saw the report. They said the biggest single killer of children under 5. Why would we have such an enormous, statistic, of death among children under 5 when it's so treatable?
Yes, perhaps because you look at each case on its own. The major reason why people may die from pneumonia, presenting late in the hospital, or not going to hospital at all.
We'll come back to that. I believe we have a caller on the line. Hello, Peter. You're welcome to the program, Peter.
Hello?
Yeah, hello, go ahead, we can hear you.
Yeah, please, I'm hearing the program. I will ask a question for the chief of police. I'm finding my own self. I don't know if you have the statement for that for me. Hello?
Hello, could you turn down the volume of your TV set? Perhaps we could hear you better.
I have done that. Before the model.
Okay. Go ahead.
Can you hear me now? Hello?
Go ahead, we can hear you.
Okay, please, I think I have a question concerning my own health. I don't know if there's a solution for it. Doctor, please, I have this problem of headache. It's up to 10 years now I've been experiencing this. So in year 2011, I went for a test. The test result came out. I was placed on injection for 6 weeks, of which I completed the injection. So throughout that 2011, it did not come again. But as I'm speaking to you now, this program is further thing. It has come back again. On one side of my head, continuously. Once I wake up for sleep, from morning till night, that headache continues. And there's this red cloth that normally come out of my nose, yellowish in color. And whenever the thing is disturbing me, I don't have myself again. So this, I don't think you have anything to tell me concerning this. So I can cure it to one for all. Thank you.
Okay, thank you, Peter. I believe he's talking about a headache.
Yes. But Peter, the truth of the matter is that over the phone, like we're doing, it will be difficult, if not impossible, for any doctor to solve the problem for you. The only advice I have for you is that you need to see your doctor again. And if he needs to call in a specialist for that particular illness, so that they can get into the details of your problem and then know how to solve it for you. It's not something we can solve for you over the phone.
Okay, now. We were talking about people presenting late being one of the reasons why there's such a death toll, at the hands of pneumonia. But we've already taken care of that. You said that within 3 days, if there's no improvement, the person should actually go see the doctor. But is this something that doctors readily see?
It's very, very, very common. Very, very common.
Because my experience is that, somebody goes to the hospital, oh, you have a fever, they're already writing malaria drugs. Should we be concerned that it may go unnoticed?
No, whilst not defending that practice, the truth of the matter is that the doctor-patient ratio in our country is quite large. If you come to a clinic where a doctor has to see 80 patients, sometimes 50, 60, the doctor has to be in a hurry. I'm not saying, in other words, because of shortage of time, doctors are in a hurry.
So we need more doctors on the block.
So we need more doctors.
I believe we have another caller on the line. Lawrence, your question or your comment?
Hello, good afternoon.
Good afternoon, Lawrence. We can hear you.
I'm Lawrence from Omai.
Yeah.
I thank you for this program. I'm very much happy about it. 7. I have been having this cough, cold whenever I take cold, or ordinary cold water, or I'm on the breeze, I will feel pain, and I've been taking some antibiotics. I have gone to doctors, they have checked, then to no avail. Even as I'm talking now, I still have cough, and it is cold. I feel pains at my back and both the sides of my body.
Okay. Thank you, Lawrence.
Yes, Lawrence. Again, unfortunately, we need details. And the most important detail we need is you need to be examined. Mm-hmm. Your chest has to be examined. You probably also will need a chest X-ray because it's possible you have TB, it's possible you have asthma, just guessing widely. And the treatment for each is different. So a doctor will need to examine your chest, maybe do a blood test, maybe do an X-ray of your chest so that they know exactly what you have and give you the appropriate treatment.
Thank you. Now, is there a way of preventing someone from having pneumonia?
Yes.
Making sure it doesn't happen in the first place?
Yes. Unfortunately, what you need for prevention, good ventilation, prevent overcrowding. These are outside medicine. It's more of the leadership. Houses have to be built, so this house should not be closed. Then to prevent overcrowding, you're talking about family size. If a man has 7 children and can only afford 1 room, you cannot talk about overcrowding in this kind of thing. But what we really need is good ventilation, prevent overcrowding.
So what you're saying is that the germs are present.
The germs are present.
The issue is to get them moving along as fast as possible.
Blown out of the room as fast as possible. Because if you have poor ventilation, the germ kind of stays, is not blown away. So when houses are crowded together, when you can't open your windows, maybe for security reasons, when there are many of you, in fact, if you can get every Nigerian to have a bedroom to himself or herself, that will go a long way. Because what you have, you keep to yourself. You're not passing it on to somebody else. But when you have people sharing, you just need one person to bring it in, and every other person will breathe it in, and it will come down with pneumonia.
If we take these preventive measures, which you say, more space, more ventilation. Is that all? Are there other things one can do?
Yes, you could talk about vaccines. But the problem with vaccination is this. The vaccines have to be made where you need to use them.
Okay.
Importing vaccines from India, Europe, America, the vaccines will be made against the type of bacteria they have over there.
Okay, not
And
particular to our own brand of
not
pneumonia.
particular to our own type of germ. So you are just assuming or hoping that by administering we can protect against our own, or you are hoping that the germ we have is the same germ as where the vaccine is coming from.
So
that's the
too
snag
much guesswork there.
That's the snag there. Ideally, the vaccine should be made where you want to use it, so that you make it against the strain of the bacteria you have in that society.
Thank you very much, Doctor, for enlightening us on this. I'm afraid we are out of time and we're going to have to close. Thank you out there so much for being with us, for listening, and for your contributions. That has been Health Matters today. Have a great day. And don't forget, good ventilation and less overcrowding can help. Have a great day.